Bladder cancer is a serious health condition that affects thousands of people worldwide. It's vital to understand what bladder cancer is, recognize its symptoms early, know the causes, and explore the available treatment options. This knowledge can save lives and improve outcomes for those affected. Bladder cancer begins when cells in the bladder start to grow uncontrollably. The bladder is a hollow organ in the lower abdomen that stores urine. The most common type of bladder cancer is urothelial carcinoma, which starts in the urothelial cells lining the inside of the bladder. There are other types, including squamous cell carcinoma and adenocarcinoma, but they are less common. Bladder cancer symptoms can vary, but the most common sign is blood in the urine, also known as hematuria. It might be visible to the naked eye or detected through a urine test. Other symptoms may include frequent urination, pain during urination, lower back pain, and the feeling of needing to urinate without being able to. It is crucial to consult a healthcare professional if you notice any of these symptoms, as early detection can significantly improve treatment outcomes. The exact cause of bladder cancer is not always known, but certain risk factors can increase the likelihood of developing it. Smoking is the most significant risk factor, as harmful chemicals in tobacco can accumulate in the bladder. Other risk factors include exposure to certain chemicals in the workplace, chronic bladder infections, a family history of bladder cancer, and previous cancer treatments involving radiation or chemotherapy. Understanding these risk factors can help individuals make lifestyle choices to reduce their chances of developing bladder cancer. Diagnosis usually begins with a review of medical history and symptoms, followed by a physical examination. The most common tests include urine cytology, cystoscopy, and imaging tests like CT scans or ultrasounds. In a cystoscopy, a thin tube with a camera is inserted through the urethra to view the inside of the bladder. If an abnormal growth is detected, a biopsy might be performed to determine if it is cancerous. Treatment for bladder cancer depends on the stage and grade of the cancer, as well as the patient's overall health. The main treatments include surgery, chemotherapy, radiation therapy, immunotherapy, and targeted therapy. Surgery is often the first step, especially for early-stage bladder cancer. Procedures may include removing the tumor through the urethra or, in more severe cases, removing the entire bladder. Chemotherapy uses drugs to kill cancer cells or stop them from growing. It can be used before surgery to shrink tumors or after surgery to kill any remaining cancer cells. Radiation therapy uses high-energy rays to target and kill cancer cells and is often combined with chemotherapy. Immunotherapy helps the immune system recognize and attack cancer cells. Bacillus calmette-guerin therapy is a common form of immunotherapy used for bladder cancer. Targeted therapy focuses on specific molecules involved in cancer growth and can be an option for advanced bladder cancer cases. Living with bladder cancer involves regular follow-up care, managing side effects from treatment, and making lifestyle changes to improve overall health. Preventive measures can include quitting smoking, avoiding exposure to harmful chemicals, staying hydrated, and maintaining a healthy diet. Regular screenings are also important for those at high risk. Bladder cancer is a challenging disease, but with early detection, informed choices, and the right treatment, many people can manage it effectively. Staying educated and aware of the symptoms and risk factors is key. Share this information with your community to raise awareness and help save lives. If you found this information helpful, please subscribe to our YouTube channel, First Aid Academy, for more educational content on health and wellness. Your support helps us continue to provide valuable information to everyone.